PLATO ACT 4 is a randomized trial which evaluates the reduced dose of chemotherapy on patients with early stage anal cancer. So the aim of the study was to see if a reduced dose of radiotherapy could could maintain the same local recurrence-free survival in patients with early anal cancer. That means T1, T2 less than 4 centimeters and 0. So the study was conducted on 160 patients, and the randomization was 2-to-1. So 2 patients were put in the experimental arm, and 1 patient was put in the standard arm. We randomized 160 patients. So what they found was that reducing the dose from 50 gray to 41 gray in 23 fraction may obtain the same rate of complete response. And this was already presented at the ESTRO 2023 with 10% less of acute response. In this meeting, the group presented a long-term outcome on local recurrence-free survival. And what they found was that delivering a lower dose of chemoradiation to this category of patients with anal cancer, this does not reduce the local recurrence-free survival, which remains more than 85% in these patients. So when I discussed the trial, since they found the same rate of complete response, 10% less of grade 3 acute toxicity, radiotherapy could be delivered in a shorter time, and the research group, which is behind the study, is very strong because they ran a series of trials in a disease which is really, really rare. My comment in the ESTRO was that this trial changes the practice of the treatment of this category of patients. So that means T1, T2 less than 4 centimeters and 0. Then I went deep in the trial, and what we found that in patients who were treated with the standard radiotherapy at 50 gray, they had a less compliance, so they had a more radiotherapy interruption and less concomitant chemotherapy. So it might be that this less compliance due to the higher toxicity in patients treated in the standard arm may have decreased the results of patients treated with higher doses. On the other hand, the group, as a secondary endpoint, went also to evaluate which were the long-term outcomes in terms of patients' reported outcomes, going to evaluate the global health score, the bowel function, and the sexual function. And what they found that in the 2 arms, even decreasing the dose of chemoradiation, there were not any difference. That this might be that in the future we should run trial who try to modify not only the dose of radiotherapy, but it might be that with the possibility to integrate imaging in radiotherapy, especially MR in radiotherapy, we could decrease the volumes that we radiate with lower doses.